welcome to Your Health Matters. I'm Pat Williams, Dr. Benjamin Bryant, Chief of Staff and Chief General Surgeon here at Conneaut Medical Center. You know, Doc, the last time we did a show, it was still winter.
Sure was.
And now we're in spring.
Well, it got a little frosty last night.
It did. It really did. It's pretty cool today, too.
It is, but I looked at the weather, and the day after tomorrow is supposed to be 66.
Yeah, we got 60s coming up for the next couple of weeks, I guess.
Yeah.
I'll take it.
Yeah, absolutely.
We can't complain. It hasn't been a bad winter, really.
Yeah.
So, I see we have a guest with us today.
Well, we have Robyn Moodt with us today. Robyn is a clinical pharmacy specialist with UH. She works here in Conneaut, works in Geneva. Do you go to Geauga too, Robyn? Or?
Sometimes when they need me. Mm-hmm.
When they need you.
Yep.
And I actually found out about Robyn from our CEO, Jason Glachevsky, who by training is a pharmacist and was a pharmacist within the UH system for quite some time before he took over administrative responsibilities here and in Geneva and in Geauga. And Jason indicated to me that Robyn might have something of great benefit to our public to offer. And so today, I'm hoping is the first installment of that. And I'm hoping after today, Robyn may agree to come back and join us in ongoing fashion. As a pharmacy specialist, everybody has questions about their medications. Everybody, and there's lots of disinformation and misinformation and confusion and so on. Everything from why am I taking this medication, to what are the side effects, to gosh, it's so expensive, is there some way I can do it that's less expensive? I mean, zillions of questions. And so I think the information that Robyn is going to give us is going to be very helpful in clearing a lot of those kinds of things up. And we're really glad that she agreed to join us.
Excellent.
Robyn, how did you come to UH?
Well, I actually started my journey in pharmacy with going to John Carroll University in Beechwood, Ohio. I got my bachelor's degree there, and then I went up to LECOM, right up the road here in Erie, and that's where I got my pharmacy degree. I then went on to, my first experience at UH was actually at Geauga in Chardon. That's where I did my residency for about a year. And then I went on to get hired with UH Geneva and Conneaut.
Excellent.
So that's how I kind of got my foot in the door here.
And what is it actually within the system that you do?
In the system, so my title is a clinical pharmacy specialist. So that's a little different than what everybody kind of knows as a pharmacist. What I do is I round with the doctors, which means that every single day I look up every single patient. I see what medications they're on, I see what their medical history is going on with them, and I match it up. And so I see, is this the best medication for them? And I give my recommendations to the medical staff. I work with the nurses, I work with respiratory therapists, occupational therapists, the social worker, kind of everybody as a team to make sure that we're caring for the patient appropriately.
If people think about what Robyn just said, okay, you can see that there's a tremendous safety factor here.
Mm-hmm.
That's what really this is about. That sometimes in the speed with which clinical decisions have to be made and with things as they evolve rapidly on the floors and so on, decisions gets made and then people move on and so on and so forth. Conditions might change, but medication lists may not be revisited, okay? Does the person still need to be on this medication? Now that we know a little bit more what's going on, is that exactly the right medication? And so what we have here is a trained specialist who's watching over all of that stuff and then saying, whoa, we gotta make a change here, and bringing it to the appropriate people's attentions so that the medications that our patients get are the right medication, the right dose, continued for the right amount of time. I mean, that's very significant. And how has that, go ahead, Pat.
I was going to ask you both. Say if somebody comes into the hospital and they're already on medication, do they bring their medication from home, or do you have that medication here to take care of them?
that depends, but that's going to be very much in Robyn's province, so why don't you go ahead and answer
Yeah,
that?
that's a very good question. I get that a lot from patients. So when you do come into the hospital, it actually, I have to say, it depends. So there's different ways that you can get admitted into the hospital. One is through observation. So that means that the doctor just wants to kind of look at you over a 24-hour period just to make sure everything's okay before they send you off. When we get observation, usually people bring in their home medications.
Okay.
They get sent up to the pharmacy. Our pharmacy staff checks them, just make sure that what's in the bottle matches what it says on the outside of the bottle, and that it's your medication.
More safety.
Yep. We send it back down to the nursing staff, and they distribute out your medication.
Okay.
There's another way that you can get admitted called inpatient, and that means that you are going to receive our medication stock. If we do not have it in stock, we will ask you to bring in the medication, and it'll go through that process again. It'll go up to the pharmacist, we'll ID it, it'll get sent back down to you, and you can take your home medication, depending on what it is.
Okay.
Now, Pat, you probably are seeing that what Robyn's talking about here is not a clinical issue, okay? It's a governmental guideline issue, okay? The government has very strict definitions for what observation status is, what inpatient admission is, okay? All the rules and regs that come from the government,
Okay.
okay? It doesn't have anything to do with the clinical actual problem. It has to do with the regulations from the government.
Okay.
And it's those regulations that determine whether you're going to have to bring your own medications or you're going to receive medications from the hospital pharmacy.
Okay.
Okay, and that's what that's about.
Okay.
Yep. Yep. And I should say, with observation patients, you can take our stock, but it's going to cost you a lot more money in that respect.
the problem.
And that's where the problem lies. And so it's cheaper for patients out there if your observation to bring in your medications.
And Robyn, thank you so much for bringing that up. I want to hit that point again very hard, okay? Because it is, as you might imagine, in this wilderness of regulations and so on, it's not uncommon for patients to get ambushed by the costs. You know, they come in, they're not feeling well, you know, they just want to go to the doctor and feel better, so they come to the emergency department or they come to their doctor's office. Doctor says, well, you know, I don't feel comfortable sending you home, but I don't know if you need to be formally admitted to the hospital. So what we're going to do is we're going to put you in observation status, which means that you're going to be monitored, you're going to receive testing, the nurses will be watching you, okay. And the patients don't realize, oh, well, I'm going to the hospital, okay. They don't realize that if they get medications from the hospital, let's say, for example, that they're on a heart medication, a beta blocker, and we're going to have a show in which, Robyn, I'm sure we'll talk about beta blockers, but let's say that they're on one, okay, and they have the bottle of their pills at home, but they get put on observation status, and they don't bring their medications with them because nobody told them, okay, but they have to have their beta blocker, so they get it from the hospital while they're in ob status, and whoa, that pill, I hope that pill's made out of solid gold, you know, because it's very expensive when it comes through the hospital. Whereas if they brought it from home, it would have cost them nothing. You see what I'm saying?
Right.
So we want patients to understand. We want to get this message out to the public that, you know, when you are coming into the hospital and you're talking with your doctor, you can say, "Am I observation?" Just write that word down. Am I observation? Because if you are observation, you definitely want to bring your own medications with you. Then you won't get ambushed. So
I never thought about that price tag either.
Oh man, so I'm really grateful. See, this is why it's an advantage to bring somebody like Robyn here, because
Sure.
those issues come up and then people find out about them.
Okay. Okay.
Okay. So I hope that answered your question.
It did. I was not totally unaware of all that
Yeah,
situation.
most people aren't aware.
Yeah.
Okay.
Great question.
And so we see now that Robyn is really watching over all of these things and helping the doctors, helping the residents, helping the patients, making sure that the medication situation is tight, accurate, and is being followed properly. Okay? Now, I would imagine, obviously, in your training, that you come into contact with a great deal of medications, basically all of them. That's your province, that's your responsibility. And I'm sure that you see all kinds of issues out there in terms of patients' understanding, things that would be helpful for them to know so that they could handle that whole aspect of their care, medications, easier, better, with better understanding, and so on.
Mm-hmm.
And I'm hoping those are the kinds of topics that we're going to be covering with Robyn as we go along, because all of it is information that's very helpful to people. Remember what this show's about, folks: empowerment. The more you know, the more you understand, the safer it's going to be for you, and the more control you're going to have. And as I understand it, you know, everybody is grappling with the cost of medications.
Mm-hmm.
And why do I have to have this medication when that medication basically kind of does the same thing? Like, they went up and looked on the internet, you know, which can be dangerous, and found out that it cost a lot less. Or why can't I go to Canada and buy my medications in Canada? You know, that all those kinds of questions come up.
Mm-hmm.
And I think you were planning on talking about affordable medications today.
Yep.
What do you have for us?
Yeah, so I've made a presentation for you guys of 5 of the biggest tips that I give to my patients to help you guys actually save some money on your medications. And we'll go through my presentation, and I'll go through every single tip with you guys. Now it's not all inclusive. There's a ton of stuff that you guys can do outside of my 5 tips, but these are the 5 top things that I like to tell my patients.
Well, starting with 5 good tips is a great way to start. Are you ready to get going on this?
Mm-hmm. Let's do it.
Robyn has prepared a very nice presentation for us, and so we're going to change the lighting here so you can see it.
Great.
And
All right, guys. So,
Matthew, I'm hoping that this is showing up nicely now.
Yeah.
Okay.
all right. So again, my name's Robyn Moodt. I'm here with Conneaut and Geneva Medical Centers. So I first wanted just to make sure that you guys know exactly how to save money on medications. That's exactly the objectives that I have here. Help you guys find ways to save money, and also allow you guys to know exactly what questions to ask your doctors and your pharmacists so that you can save money in that respect too.
Excellent.
Now, I want to give a little caveat right at the beginning here. A lot of my tips have to do with the internet, on the websites, all that good stuff. Now, if you do not have internet access, there's a lot of different things that you can do too. All of these websites that I'm going to show you today have phone numbers that you can call into. Your assistant centers, your assistant programs that are out in the community right now can help you. Us pharmacists, we can help you kind of find different ways to do it and find the phone numbers that you can use. So I'm going to tell you guys the tips as I go through it, and I'll tell you exactly, you know, which one's for this insurance, which one's for that insurance, and we'll kind of go through it. So first off, I just wanted to give you guys some stats. All right, this is from the Center of Disease Control. These are from these stats of actually ways that people try to save money right now on medications. So look at these percentages, guys. 15.1% ask their doctors for a lower cost of medications, and that's great. That's exactly what I want you guys to do. That's a great first step. Is there something else out there that actually does the same thing and has a lower cost? 8% of people actually did not take their medications because the money was so high. Now, I hate hearing this, because there's a lot of different things that we can do to try to get you that medication that you need at a price that you can afford. And then 1.6% of people actually bought it from a different country. So that means going up to Canada or going down to Mexico. And at this point, I did want to just make sure that you guys know, if you guys are doing that, you have to be careful. Canada, Mexico, England, wherever you're getting your medications, they don't have the regulations that USA has. All right, so we have to be careful exactly what we're getting. When I say regulations, I mean that maybe what's in that pill is not exactly what it says on the bottle. So we have to just be careful.
So their regulations are not as tight as the FDA.
Exactly. Yep, the good old FDA, the Food Drug Administration.
We have talked about that several times on this show.
Oh, very good, very good. Yes, so we just have to be careful getting it from other places, okay? So, I already told you I got 5 big tips for you guys. So let's start. Tip number 1, this is for everybody. Any type of insurance that you have, or if you don't have insurance, this is a way that you can actually save money. And the first tip, brand versus generic. All right. Now, there's two different kinds of medications out there, the brand and the generic. The brand medication is what it starts out as. So the first guy that says, hey, I'm going to start this medication gets what's called a patent. And the patent goes on for 10 years usually. And this is what's called the brand medication. They pick the name of it, and that's what happens. There's only one of that medication for 10 years. Then after 10 years, after that patent expires, then we get the generics that come out, and that's when the cost goes way down on these medications. You probably saw it with the Xarelto recently. That's a good anticoagulant. It helps prevent against blood clots. Xarelto's been out there for about 10 years, and now we have rivaroxaban and everything. And so we can actually decrease the cost a lot with those medications because we have the generic. These are other manufacturers getting into that business and saying, hey, I want to produce this medication too at a lower cost for patients.
I think a lot of people have probably had experience with Prilosec and omeprazole.
Oh, yes. Yep.
Where the price went through the basement.
Mm-hmm. Exactly.
Yeah.
Now, a little stickler about the brand to generic and everything. Yes, the active ingredients in those medications are exactly the same. So you're still going to get the same effect usually. It's going to be okay for you. The only difference in those pills is the inactive ingredients. So it's everything else that's in there that we kind of put into the med to make sure that it's getting absorbed properly in your body and that it can be the size that we can kind of take the medication, all those other things. So if you have some sort of allergy to some medications, some things that are in medications like lactulose or sucrose or something like that, we want to make sure when you're switching from brand to generic that you know exactly what's in the pill that you are taking. That's the only caveat. You're still going to get the same effect, and usually it's pretty safe for everybody. All right? So that's my first tip for you guys. The second tip. This is for everybody too, whether you have insurance or not. This is looking at medication lists. All right, so there's free antibiotic lists, there's $4 lists, $10 lists out there. The first one I'm going to target is the free antibiotics. All right, so I kind of scoured the internet trying to find lists of antibiotics that you guys could get for absolutely free from a pharmacy if you have a prescription from a doctor. And these are the big ones that popped up. Now, unfortunately, pretty much all of these are not around us. The big one is Giant Eagle. All right. Now, unfortunately, right now, Giant Eagle's free antibiotic list expired February 28th. Because usually it's throughout the winter months when people are getting a little more sick. You have some sniffles and some sinus infections going on. That's when we get the most antibiotic use, and that's when they have the free antibiotics out there for people. But for next year, I want to make sure you guys know that this is available for you. Because it'll pop back up at around October time. And it'll go throughout the whole winter for Giant Eagle people. So that way you can get free antibiotics through there.
How do people find out what's on Giant Eagle's list?
Very good question. You can actually go to their website and actually it pops right up for you. If you don't have internet access, you can go to Giant Eagle and ask them for a list. They have lists there that they can provide for you too. Now here is Walmart's $4 and $10 list. And this is only 3 out of the 6 pages. I just wanted to show you exactly how it's all set up. And again, I pulled this right from their website. But if you do not have website access, you can always go to your local library and get internet access. Or again, go to Walmart and ask them for a list of these.
Yeah, I think that's important for people to realize. You can go to the library and they have computers.
Mm-hmm. Yep.
And they have people who know how they work.
Mm-hmm.
And they can help you get so you can see this list for yourself.
Yep.
Without having to go all the way over to Ashtabula or, it'd be impossible to get over the phone, that we can read this over the phone. Without having to go there, you can actually go to our library here in Conneaut and get this information.
Yep. Now this is just Walmart's list. Usually every pharmacy that's out there has their own list, even independent pharmacies. So I want to make sure you guys know about this because it can really decrease your costs. And sometimes pharmacies even just use their list without you even knowing. They don't even go through your insurance. If it's on this list and it's cheaper than your insurance is going to get you, they'll plop you on this list and they'll use this instead.
I'm pretty sure that Rite Aid here in Conneaut does that. They had a program where they were doing the Walmart price match.
Yep. Oh yes, price matching is big too.
Okay, so I know, I'm pretty sure Rite Aid does, and I would have to guess that CVS does too if they're going to compete.
Yeah, the big name guys, all of them usually have these lists out there. And it has a lot of different, these are kind of the main drugs that people have, and it's in a ton of different categories. Like this one, this is a new one for this year for Walmart. They actually added a men's health section. So one drug, finasteride, which a lot of men are on at the moment, that's put on there for you. Now sometimes the prices are not just $4 and $10 based on some things, but they're a lot cheaper than other things. I think the birth control section of this actually has them for like $20 to $30. But it can be a lot cheaper than just paying right out of pocket.
Now folks, when you go to Rite Aid here or CVS here, I think they usually do this automatically. They usually do the price match automatically, but you can ask the pharmacist about that. When you go to pick up your medications, you can ask, did you do a price match? Did you match Walmart's price? Or do you have your own medication list, your own $4, $10 medication list? If you're armed with that information, you just ask that question. And then you're going to be assured that you're going to get the benefit of the lowest price.
Yep. And also with that, I know some places have kind of banned price matching too. So don't be alarmed if they say we do not price match anymore either. Because some places have said, nope, we're not doing that anymore. Just to let you guys know out there. So
Well,
you can
okay.
get some, you can get the backlash of that too.
That's important to know, but the thing of it is, if you've gone to the library and looked up your medication on this list and know what it costs over there, then when you go to the pharmacy here and you ask what it costs, you'll know whether it's more or the same.
Exactly.
So if you're armed with that knowledge, you're going to keep that money in your pocket.
Yep, exactly. Yep. So tip number 3. So this tip is really for people that have insurance, okay? And this one is getting familiar with your insurance company, all right? Now, not a lot of people know this, but sometimes insurance companies actually have pharmacies that are in your network. It's not just the doctors that are in your network, it can actually be the pharmacies too. And not a lot of people know that they're going to the wrong pharmacy and they get higher costs because of it. So this is actually working with your insurance company. And so that is calling into them and asking them, do we have pharmacies in our network? Which one should I go to? All right, and
They call their insurance company and ask that question.
Yes, exactly. This is a website. This is one of the many insurance companies that are out there, OptumRx. And this is actually, I got through this using United Insurance Company. So what United Insurance Company actually has a pharmacy on their network. And so what happens is that we have to locate the pharmacy. And I thought this was a good page because actually you put in all of your information and you have to locate the pharmacy that actually shows with that insurance company so that you get the lowest price. Also, it has another good aspect on here, the formulary. So not a lot of people know that insurance companies have formularies. What a formulary is a list of medications that actually the insurance will cover. And so if you have a medication that's not on that list, your insurance company won't cover it. But usually what's on that list is an alternative that they will cover. And so that's where a lot of people get in the mud a little bit because it's not that one medication that your doctor prescribed. It has to be the one that's on the formulary or you're not going to get any coverage for it. Now, with these formularies, every year they can change. So I'm betting some of you have actually got a letter from your insurance company saying, oh, we're not covering that medication anymore. Sorry. you have to talk to your doctor. Well, usually there's some sort of interchange. There's some sort of swap that they did where they said, oh, this one's going to be more cheaper to cover, so we're going to cover this one and not that one. So that's going to be having to work with your doctor and work with your insurance company.
This is complicated, folks. It's a pain in the neck, but unfortunately, it's business as usual in our world,
Yes.
okay? You have to understand, insurance companies are huge companies, multi-billion-dollar companies. So are drug companies. And if you don't think that they're working together to make deals with each other, they are, okay? And I know a lot of patients can relate to this. Well, I was taking Nexium and it was working great. And then I got a letter from my pharmacist and they're not going to cover Nexium anymore. So now what do I do? So then you have to go on to a different,
Yes.
okay? And it's important to know that. It's important to know that there are such things as formularies, that you can, it's a pain, but you know, if you do it, if Robyn's giving you the information here, if you go to the formulary, you know what's covered, it can result in hundreds of dollars over the course of a year staying in your pocket as opposed to leaving your pocket.
Yep.
So it's worth doing.
Yep. Another thing with insurance companies too is that they like people to be in a mail order system too. Now, what a mail order system is that it's just like a normal pharmacy. You just get your prescriptions mailed to your front door. Now, there's pros and cons with this. The pros is that yes, it comes right to your front door. That's great, and usually it can be pretty cheap. You get a 90-day supply of medications for a cost of a 60-day supply usually, or sometimes a 30-day supply. So it really can save you some money there. Now, a con of this is if you're not really stable with your medications. Now, when I say that, I mean if you're changing doses of medications all the time, or you're changing frequency, so you're taking one twice a day, and then the next month you're taking it 3 times a day. If we're not really stable, it can hurt you sometimes, because from the time that prescription goes to the mail order pharmacy, it can take up to a week to 2 weeks for you to get that medication. So I want to make sure you guys are taking your medications too within that 2-week time span. And so to do that, you usually have to be pretty stable on your medications. Now, if you do decide to go into the mail order pharmacy realm, that's okay. You can still go to your local Rite Aid, to your local CVS, to your local Gertie's. You can still go all of those places for your medications that kind of fluctuate all the time. It's just not going to be in the same computer system. That's the only thing. And I like to keep medications in the same computer system because that's when we can get interaction checker on there. And we can make sure that, you know, none of your over-the-counter medications or herbals or vitamins that you're taking are not interacting with any medications you have, if your pharmacist is looking at a complete list of your medications in their computer system. But a mail order pharmacy, if you guys are stable on your medications, it can really save you a lot of money if you go through that, and you get them sent right to your door. So that's really nice too. It saves you a trip out to the pharmacy as well. So,
Very good.
all right,
Very good.
good. So tip number 4. All right, this one is pretty much for everybody, but I'm going to put a but in there when we talk about this type of thing. But this is using coupons. All right, so we can use coupons for a ton of different medications. I have my 4 kind of pillars here where you can get coupons. You can get them from the manufacturer, you can get them from the pharmacy, you can get them from websites that are out there, and you can get them from patient assistant programs. I'm going to go through each one of these. There's a ton of other ways you can. Even if you just Google in the Google search your name of your medication and coupons, you'll get a whole list of different things that you can use to help you out in saving money. First off, manufacturer. This is going to be the most reputable coupons out there because it's coming straight from the manufacturer of that drug. Now, as you can see, this is just a little sample of what's out there for you guys. Now, I want to kind of dive into each one of these, a little further. Now, you can see that some of them have a free trial offer and some of them have a savings card. And so let's dive into that a little bit. We're going to look at Farxiga. This is a diabetic medication, a pretty brand new one out there. And so I clicked on both of these buttons for you guys, and this is what pops up. So a free 30-day trial. That sounds good to me. Every month free. That sounds even better. For an entire year, you could get this medication for free. But with these coupons, you always have to look at the eligibility requirements. All right? So, for this one, all you have to do is have a prescription for Farxiga, be 18 years and older, and be a resident of the United States. That's all you need for this medication until you get this free 30-day trial. Awesome. But that only gets you 30 days. You can only use this one once in an entire year. Now let's look at the every month free one. Look at how many eligibility requirements this one has. And the biggest one that's in there is that, unfortunately, this one does not, it excludes everybody that has federal insurance. So that's Medicaid, Medicare, all those are out. And that's what a lot of these good ones that are out there, if you have Medicare or Medicaid, unfortunately, you cannot use them. All right. I get a lot of people bringing these coupons to me and they're very excited. Oh, I can get this medication for free for a year. Run the numbers and put all these different codes into the system. And no, you're not eligible because of your insurance company. So it's just looking at those, at kind of the fine print, and the biggest one is the eligibility, because you'll see a lot of fine print underneath these coupons. First, number one spot you want to look is the eligibility. Make sure you guys are eligible for those coupons. Now, it's always worth a try. You can always go to your pharmacy with these coupons and ask them to put in these codes, and that's fine. But sometimes we can't use these type of things, okay? Now, the pharmacy. So actually the pharmacies out there have coupon cards for people. And a lot of you guys probably don't even know that you're using the coupon cards from the pharmacy, because they just input this for you just to save you some money. Now the one here, Walgreens, they actually have a savings program that you pay to be into. Individuals, I think it's about 25 bucks. If it's a family, it's about $35. But sometimes it can really save you some money.
Is that a one-time cost, or?
Yes, I think it is just a one-time cost to get in there, and then you're into the program. And it has a ton of different discounts in there if you go and look at everything. So it could really save you some money too if you kind of dive into that. But each one of these guys has their own free prescription savings cards too that you might actually be benefiting from and you don't even know at the moment. Then we have websites. So there is a ton of different websites out there that can help you guys. I like GoodRx.com. Maybe some of you have seen the commercials for GoodRx.com, but this is what's going to pop up for you if you go on that website. Now what I did is I put in Lipitor here, which is a pretty common cholesterol medication, and this is what pops up. So this is what you're going to see when you hit search. You see all these different pharmacies out there, and they give you the price of exactly what they're going to be, which is really nice. You can actually make an account at this website, put in all of your information and your location, and it'll actually pull up the surrounding areas pharmacies for you guys so that you know exactly where to go around here in Conneaut. So as you can see here, if we go to Walmart, it's going to be $14.27. But it's with this discount card, this coupon here. All right, because GoodRx has their own coupons for you guys. And you can customize this to be whatever you want. You can change the dose of the medication. You can change it to a 90-day supply if you want to see what the cost is going to be for you with that. So it depends on your prescriptions. Also, I did want to just throw out a little caveat with this. They actually just started GoodRx for pets. So if you guys have some pets out there, I know prescriptions for pets are so expensive because usually they're not covered under insurance, so you got to pay out of pocket. Try this with your pets too if they have any prescriptions. So all you got to do is press this button over here, and this is what pops up. This is your discount card. You print it out. If you don't have a printer, you can actually write down these codes for your pharmacist, and they can input those codes right for you, right on a piece of paper. Now, again, another caveat with GoodRx. Some pharmacies have said that they are not going to take GoodRx coupons anymore. So, if you bring in this coupon, again, it's always worth a try. It's always worth going up to your pharmacist, hey, can I try this coupon to save some money? Go right ahead. But just know that sometimes the pharmacist will say, I'm sorry, but our company will not allow us to use this type of coupon. Okay? But it's always worth a try to save money.
Sure.
And then we have our patient assistance programs. And actually, this goes along with my next tip for you guys. So this tip is for anybody, whether there's insurance or not here. And this is patient assistant programs that are out there. All right. Now I'm just going to give you 3 different websites that you guys can go on to, but there are a ton of different patient assistant programs that are out there. This one is one of my favorites, needymeds.com or .org. This one, if you put that into the search bar or into the website bar up here, this is what you're going to look at. Now I know this looks pretty busy, but what I really want you guys to focus on is this drug search right here. Okay? All you have to do is put in your medication and hit search. What I did again is Lipitor, so that cholesterol medication, just as an example. And this is what comes up. So it searches all different types of websites to see what kind of programs are out there for Lipitor. Okay? So as you can see, there's patient assistant programs, there's copay cards, $4 generics of it. There's actually support groups, if you wanted to go into a support group. There's a lot of different help on here for you guys. And this can be for any of your medications. It's always worth a look on here to see how you can save money. And all you got to do is press on these things to see exactly what you need to do for each one of them. Now this is another one here, RX Assist. Now this one is just kind of looking at patient assistant programs. So this is what you're going to see if you go to this website. And down here is where you're going to search. Now you can put in multiple drugs if you want, or just search one per each search bar. I put in Lipitor again, and this is what comes up. So as you can see, there's 3 different ways that we can save money here. We have a Lipitor choice card. That's from the manufacturer, like I said. Those are the most reputable. The Pfizer savings program. So that's from Pfizer. That's another manufacturer of it that can help you. And then also there is an outreach program. So that's a patient assistance program. With patient assistant programs, usually you have to have some sort of application with them. So you got to fill out something, send it into the company, do it online or do it over the phone, depending on how you want to reach them. But this could be a very good way to kind of save money. Now with patient assistant programs, I have to tell you guys, usually they have a set amount of money for each program they have. So sometimes when they run out of that money, so a lot of people are in that program and they run out of money, sometimes they close the program. And that's when people get rejected. But it's always worth a try to see if you get accepted with your application. This is another one, Partnership for Prescription Assistance. This website actually does it a little backwards. So you actually, when you put in your medication here and hit search, you're going to go through a questionnaire saying if you're even eligible for certain programs. And they're going to target the program that you're eligible for. So that's kind of nice because you don't have to do the searching. This guy will tell you exactly which programs you're actually eligible for now. And then you can apply right through this program here. So I like this website as well. And again, all these websites have phone numbers that you can call, and they actually have applications that can be sent to you, and you can send them in through the mail too. It's just making sure to get this information out there to the company so that you can get applied for it. So those are our 5 tips, guys. All right, to wrap up, try to switch to generic. The second one is look for medication lists, the $4 list, the $10 list. The third one, get familiar with your insurance. Make sure you know the ins and outs of it. Number 4, use coupons whenever you can. And then number 5, if you guys need any more assistance aside from that, patient assistant programs are the way to go. Now I want to close kind of my presentation with tips for kind of everybody that I tell every single patient that I get in contact with. The first one is, if you guys can, always have an updated medication list with you somehow. Because we never know when you're going to go to the hospital. You know, you're not going to carry around your pills of medication all the time. So try to have just a list in your wallet or your purse to make sure that we have an updated list. Try to update that list as often as you can, really. I say monthly, but if your medications aren't really changing all that much, you can do it as your medications change type. And then, of course, if you decide to start a new medication at all, and that means vitamins, herbals, over-the-counter medications, there's herbal teas that are out there that can interact with your medications. If you decide to start any of those things, always make sure everybody in your medical team knows. And that means your pharmacist, your doctor, any specialty doctors that you have, any nurses that might be taking care of you, anybody at that point. Because we just want to make sure your prescription medication is not interacting with anything new that you're starting. Okay? And that's pretty much all I got for you guys for today.
All right, very
All
good.
right.
Pat, can you put the lights back on for us? Please, Robyn, have a seat for a minute. Wow. Talk about a lot of excellent quality information. Folks, I do, again, want to reemphasize, as we do on this show, that within a couple of weeks, this show is going to be available up on our YouTube channel. Robyn gave a lot of information here, okay? And some of it may seem to have gone flying by, but you're going to be able to get at it again. You're going to be able to go and watch whatever part of her presentation that you would like to get the details on the tips, to see how she does stuff, and sometimes going over it a couple, 3, 4 times is what you need to be able to really, oh, okay, I get that, I know what I need to do now. And I'll be sending you a copy of or a link to the YouTube when it gets posted up there.
Great.
It'll be a couple of weeks probably. Okay, gosh, fantastic. This was sort of what I was hoping was going to happen by having you come on here. This is great information for our public, and we will look forward to having you come back. I'll send you some dates and so on, if you're willing.
Mm-hmm.
And folks, again, if you have questions about a specific medication, if you have an issue about a specific medication, and you feel like you're just not able to get the information that you need to really clear something up for you, please either call this number, this is my office, and tell Karen, she'll take your question, or email Pat. A lot of our viewers do email Pat with questions, and let us know what your questions are, and I can get them to Robyn, and the next time she's on, she can address them, or perhaps it'll suggest a topic that she can devote an entire presentation to.
Yep. I'd love suggestions. Yeah.
Yeah.
Of course.
Okay. Well, I think that's going to wrap it for us today. Thanks again. Remember, your health matters, and we'll see you for the next show.